Hello there guys, welcome back if you're joining for the first time. Now, in the last video I made about inflammation. I talked about the different things we'll be looking at in inflammation, and in this video we're talking about the first part, which is the vascular events. So what are the things that happen during the vascular events? Before we start, a quick review on the five cardinal signs of inflammation: rubor, color, tumor, dolor, function lasse. In English, redness, hotness, swelling, pain, loss of function. Now we'll be seeing how all this occur during the vascular events. So let's start from the beginning. You have something going on in your body. Let's say it's a bacteria producing toxins damaging your cell, or something just happens, maybe an injury. In this case, let's say the bacteria. Now this bacteria is producing endotoxins. Now your mast cells in that tissue will see these endotoxins and start producing histamine, leukotrienes, and prostaglandins. Now these endotoxins will also damage the cell membrane, and this will start causing your cell membrane to break down. Now, phospholipase A2, also known as PLA, will turn that phospholipid into arachidonic acid. Arachidonic acid will then be converted into leukotriene by lipooxygenase and prostaglandin by COX-1 or COX-2. Now, all these chemicals that we produce, histamine, leukotrienes, prostaglandins, will go to your blood vessel and start causing effects. Histamine will cause vasodilation, which will be the result of this redness and hotness because there's not much blood flow in that area. And the other ones will cause these endothelial cells to contract, creating space for your white blood cells to move through. And also in that process, fluid also goes through. Now, this fluid going through is going to cause swelling or tumor. And this fluid can accumulate and push on nociceptors, causing pain. Now, there's another way this pain can also be caused. Now, in your blood vessels, clotting factor 12 can be turned into pre-kallikrein, which then turns into kallikrein or kallikrein, forgive my pronunciation. This kallikrein will affect or have an effect on chyminogen. This chyminogen then turns into bradykinase. Bradykinase can activate nociceptors, which are your pain receptors, and cause pain. And they also have an effect in this process too. Another thing that happens during this vascular event as a result of these chemicals acting on endothelial cells is that endothelial cells begin to produce selectins. So start producing P selectins and E selectins and others which will help adhere your white blood cells. For this part, we'll talk about it more in the cellular events. Now, so far, we're talking about how redness, hotness, swelling, and pain occur. What about loss of function? Imagine the swelling happens in your joints. Can you move that joint? No. So definitely loss of function. And that covers the whole vascular event. So what happens? We have vasodilation to increase blood flow and contraction of the endothelial cells, which will increase vessel permeability.